Today?
Doing good.
All right. My name is Tuan Nguyen, and I am the field representative for Mr. Assemblymember Kalra. And today I come, and Assemblymember Kalra has a very simple message. Let's win this together, and let's guarantee that healthcare is a human right for all Californians. Let's win this together.
Right.
Okay, next we have up Salem. Please, Salem, come up and introduce yourself.
Thank you. Is this loud enough? Should I take this off?
Can you hear me?
Yes, we can.
My name is Salem Ajluni. I'm an economist by training and profession, and I'm a member of the Santa Clara County Single Payer Healthcare Coalition and the Silicon Valley Democratic Socialists of America.
Right.
I first want to applaud and commend the many activists and organizers in San Jose and in Santa Clara County who for years and decades have selflessly given of their talents, their time, their efforts, and their money to advance the struggle for the basic human right of health care for all. In particular, I want to laud all of those who have advocated for a single-payer healthcare system of societal insurance, the most sensible and cost-effective way of financing health care for all. Such a system has, across many countries and over many decades, shown itself to be robust and resilient in producing the best healthcare outcomes combined with the lowest healthcare expenditures. The culmination of decades of popular struggles and legislative efforts in the United States has produced the best defined and most refined single-payer healthcare proposal ever introduced in the California State Legislature. Assembly Bill 1400, referred to as CalCare, was introduced in 2021, and it is what we are all gathered here today to promote within our communities and to insist on in our communications and our electoral activities vis-a-vis elected representatives in Sacramento. Simply put, CalCare would provide comprehensive and guaranteed health care services to all California residents for every medical situation and condition. Under CalCare, patients will have the freedom to choose their doctors, hospitals, and other providers anywhere in California, thereby transforming the multiple, fragmented, and frustrating care networks into a single, grand, statewide network. CalCare will mean that every Californian is medically covered for everything from cradle to grave and from head to toe. All 39.5 million Californians will be covered without co-payments, deductibles, or out-of-pocket expenses. That's right. As it stands now, 8% of Californians, 3.2 million people, have no health care coverage. 5 million, or 12.5%, are underinsured. 100% of those with coverage are gouged by the monopoly pricing of insurance companies, private hospitals, the drug companies, and the medical device makers. That's right. The results are delayed or foregone health care, leading to more preventable illnesses and deaths, especially among the poor and working poor, who in California are disproportionately Hispanic, Asian, and Black. The criminally disproportionate impacts of COVID on working class Hispanics and Blacks in particular that we have seen in the last 2 years are the clearest evidence of the underlying health inequities produced by the broken healthcare system. That is what we seek to fundamentally change through CalCare. What the now 57-year-old Medicare system and the 2-year-old COVID testing, treatment, and vaccine system clearly teach us is that healthcare access and financing are most cost-effective when the pool of patients is the largest, when there is a single purchasing entity with the power to counteract the for-profit monopoly practices that predominate in U.S. healthcare system. CalCare will allow Californians to access healthcare in almost exactly the same way we have all been able to access COVID testing and COVID treatment and COVID vaccinations these past 2 years. Readily available to everybody. Everybody can get that treatment. Even without an appointment. Free at the point of service with no regard for anyone's ability to pay. And financed by a single payer. In this case, the federal government of the United States. Through its power to progressively tax income. That is exactly what CalCare will give Californians. Universal, unrestricted access to the services we need to protect and enhance our health with a financing system that pools all the public funds that are already spent on healthcare, including Medicare, Medi-Cal, the county, municipal, and school district funds that are spent on medical care would all be pooled into a single fund. These funds would be augmented by progressive taxation of households with incomes above $150,000 per year. Increased payroll taxes on the largest corporations in the state, and increased taxes on business revenues for the largest businesses in the state. That's what the financing legislation introduced in the past 2 days in the Assembly would require in order to fund health care. In short, CalCare will give families, businesses, and governments a lower cost way to provide better health than our present system of care. Let's keep in mind that the staggering sums that Californians now pay for health care, somewhere around $400 billion per year, leaves millions of Californians without health care coverage and millions more with inadequate care. Those millions are disproportionately Hispanic Latino. So it is significant that we begin our CalCare caravan today from San Jose's Mexican Heritage Plaza. Let us redouble our efforts today and every day to make CalCare the success it must be for all of us. Health care over profit, the time is now. Thank you.
Healthcare over profit.
The time is now.
Healthcare over profit.
The time is now.
Healthcare over profit. The time is now.
Say what?
Healthcare over profit. The time is now.
Say what?
Healthcare over profit.
The time is now. Say what?
Healthcare over profit.
The time is now. Say what?
Healthcare over profit.
The time is now.
Thank you. Michele, introduce yourself, please.
Can people hear me through this?
Yes.
Awesome. My name's Michele Mashburn. I'm a member of the Santa Clara County Green Party. I'm also the director of San Jose Peace and Justice Center. And as you can see, a disability advocate and activist in Santa Clara County. Simply put, we need a single healthcare system in the United States today, if not yesterday. And currently, California has the opportunity to build back better, as it's been promising, by passing the AB 1400, the California Guaranteed Health Care Act for All. We're at a time of crisis where people are paid less than a living wage. They struggle to maintain housing and often are less than a paycheck away from a catastrophic loss. Sadly, our social safety net is also inadequate. AB 1400 will start to fix this systemic inequity and help us build a better California for everybody. The World Health Organization states that almost everyone is likely to experience some form of disability, temporary or permanent, at some point in their lifetime. At present, disabled people are 3 times more likely to be denied health care in the healthcare systems, even with insurance. They're also 4 times more likely to be treated badly in that system, and 50% more likely to suffer the catastrophic healthcare expenditure. Living with a disability is expensive in the system that we occupy, and this must be changed to produce equity in our state.
Yes. Yes. Healthcare over profit. The time is now. Healthcare over profit. The time is now.
Okay. There are many barriers and inadequacies in our current healthcare system, from location-based restriction to high deductibles and spend downs. Care is often suboptimal and results in institutionalization and sadly death of many people who would thrive if supported in their home environments. Home and community-based services are also an essential part of a healthcare system for everyone. Yet in the United States, too many people are on waiting lists for these services with an average wait time of 3 years or more. And many people are ineligible for these services because of the health insurance that they currently hold. The lack of services leads to a lower quality of life and an increased hospitalization, institutionalization, and even death. These services are currently underfunded and inadequate. My hope is that AB 1400 can bridge that gap. At the time when the reality of an existing health issue can mean death by COVID-19, we need a way to ensure everyone has access to quality and affordable health care. We live in a system of indentured servitude, and I want to say that again. We live in a system of indentured servitude because our health insurance is tied to our employment or lack thereof. We need to break the chains of this indentured servitude, and we call on our elected officials to help us free us in this process. We currently live in a broken system called capitalism, filled with economic exploitation, using oppressive systems like racism, sexism, ableism, and more to divide the population as profits are extracted from workers' lives and our well-being for the purpose of the ownership class. AB 1400 must pass to be the start of an improved system in California, ensuring that human needs are met and standards of care foster and help Californians thrive.
Healthcare over profit. Say what? Healthcare over profit. The time is now. Say what? Healthcare over profit. The time is now. Say what? Healthcare over profit. The time is now.
Hi everyone, my name is Brenda Zendajas. I am the Vice Chair of Movimiento Coalition Democratic Club, and I'm also an advocate for San Jose. I want to thank you all for being here today. I want to thank the Santa Clara County Single Payer Coalition, who has been pushing through this issue for a very, very long time. I want to thank all the other groups that are here today with us and all the local leaders. I would also like to thank Assemblymember Kalra and every leader that worked to author this bill. We do have our very local leaders who have pushed for this as well, and our City Councilwoman Magdalena Carrasco, who championed this at City Hall. The memorandum was passed in San Jose City Hall November 30th in support for the CalCare AB 1400, the guaranteed healthcare for all. I will say we have some really badass leaders here in California. Today, this month, we could be the first state to have universal health care. Like, that is huge, guys. Today, we are here to say healthcare over profit. Healthcare is an investment. It is not a waste of money when you're investing back into your community. No family should ever have to choose who is getting healthcare based on the cost of health care. Our immigrant community are essential workers, our heroes. They continue to be in the front line. They were hit the hardest during this pandemic. We lost many who did not seek medical attention because of the cost of health care. That is unacceptable and not okay. We need to be treated like humans. We deserve to be treated like humans. So I'm going to say this today. Medicare for all, healthcare over profit. Can you all say this with me? Healthcare over profit.
The time is now.
Over profit.
The time is now.
I want to thank you guys, and it is our time. We need to push. We need to advocate. It doesn't stop here. It will not stop here. And we together, as a collective, we have power. We have our voices. We have our leaders. It will happen, and it's our time. Thank you.
The time is now.
Healthcare over profit.
The time is now.
Healthcare over profit.
The time is now.
Can you guys hear me?
Yes.
All right. So my name is Carmen Brammer, and it's an honor to be here with all of you. I am a mother, a longtime resident of San Jose, and a caregiver for my mom. I'm a member of the Santa Clara County Single Parent Coalition, the Black Leadership Kitchen Cabinet, and an Alzheimer's advocate. I'm so glad that California is finally serious about a single-payer health care system. I'm urging our legislature to pass AB 1400 to walk the talk of prioritizing people over profits. I'm here to talk specifically about long-term care. It's a major component of health care that is usually put to the side. It's always mentioned as an asterisk, something to be addressed later. The great thing about AB 1400 is it includes coverage for long-term care. My daughter recently shared an SFGate October 31st, 2021 article about a new senior living facility scheduled to be released later in 2022. Atria Senior Living partnered with Related to launch this community. I was floored when I read the cost for rooms with 2 beds, 2 baths, will run upwards of $27,000 per month. Wow. Studios will start at $8,000 per month. Wow. You said it. Who can afford that? So, as it's currently structured, long-term care is extremely expensive and unsustainable unless you make a high 6-figure income. My family has been significantly impacted by the lack of financial support for my mother's care. My mom was diagnosed with dementia in 2020. She requires 24/7 care and resides in a long-term memory care facility. As I've said, it's one of the most expensive healthcare costs, averaging a minimum of $6,500 a month in Santa Clara County. That's an annual cost of $78,000. With no financial assistance available, our family bears the burden of my mom's care costs. We're not sure how long this will be feasible. My mom does not qualify for long-term care insurance, and even if she did, it's extremely expensive. Within the next 10 years, at least 20% of California's population will be 65 and over, many of whom will require long-term care. Having AB 1400 now in place will prepare California to provide viable, accessible, equitable, and affordable health care for current and future seniors. I urge every state legislator to step up, do the right thing, listen to the citizens of California, make our health your #1 priority rather than the profits of the medical industry.
The time is now. Healthcare over profit. The time is now.
I said healthcare over profit.
The time is now.
Hi everyone, thank you so much for being here today. My name is Meriam and I'm a member of the Santa Clara County Single Payer Healthcare Coalition and the chair of the South Bay chapter of Students for a National Health Program, a national organization of students fighting for single payer healthcare. Today, I'm thrilled to introduce two of my fellow SNaHP members, both co-leads of our social media team, who will highlight the necessity of passing AB 1400 for us, the next generation of Californians. Noora Fayad goes by she, her pronouns and is a senior at Saratoga High. Jana Radwan goes by she, her pronouns and is a senior at Lee High School. Thank you all so much.
Being a student in California, I've come across countless situations where classmates of mine have struggled to access the proper medical attention they needed, feeling broken and forgotten. Whether it was a lack of proper mental health services or basic needs like consistent dentist or doctor's appointments, it created a canyon between the students who could afford and the students that couldn't. Not only that, but it stopped students from reaching their full potential, unable to access basic things that are crucial to the academic environment, like glasses. It always felt as if there was nothing we could do, as if we were trapped in an endless loop in a system that was rigged against us, just for the money and not for the people. When I found that there was a way I could help, I jumped at the opportunity. I used my voice to advocate for AB 1400, a system that enables all California residents to enjoy lower premiums and better access to health care. Sorry. Why should we wait any longer? We're already behind enough. The time is now. Thank you.
Hi everyone. Hi. Okay, so volunteering at my father's local Palestinian refugee camp hospital in Lebanon, I saw firsthand the realities of healthcare inequalities and how that can be replicated in America, especially in the midst of this pandemic. America is one of the richest countries in the world, and there is zero excuse for America to not provide healthcare for its constituents without bankrupting them. America spends more on healthcare than any other country in the world, yet huge swaths still remain uninsured and underinsured. California is one of the top 5 richest states in the nation, and it is time that we hold our public officials accountable. You cannot run on single payer and expect us to forget that what you promised your constituents. It is time that our state and national government officials finally listen to the very people they were elected to serve. It is time to end the regime. It is time to end the regime of corporations, insurance, and pharmaceutical companies. It is time that the California youth especially get involved, because ultimately we are the ones going to be taking office next. And it is time that we prioritize and spend more on healthcare. All in all, it is time that California becomes a national model for single payer to further prove that it is not only the cheaper and most comprehensible option, but because it is the right, best, and only option. The youth of this nation holds the key to open the doors, eyes, and opportunities for themselves and for the people around them. And although we are too young to vote and our voices may not be heard at the ballot box, we are able to use our voices to push and support for AB 1400. Thank you.
Greetings all. My name is Donna Wallach. I am an in-home support service provider. I work through the Social Services Agency of not take care of people. Even people with so-called health care coverage, Medicare or Medicaid, do not really have their health care and health care needs covered. All my clients struggle to get their very basic needs met. Some of my clients are in severe pain and they know of treatment that can help them, yet their insurance will not cover it. I used to have a client who called her healthcare provider numerous times to get treatment that she knew would help her ease her pain, help her recover her health, but to no avail. They continuously denied her. I have seen how necessary devices that are approved to some of my clients are of such very inferior quality that they just should be thrown in the trash. I have had clients who had to pay expensive co-pays each time she went to the doctor, so she had to decide which doctor visits to cancel. I watched my twin sister suffer horrible pain with stage 4 cancer, and her then medical insurance denied everything, all treatments, pain medications, etc., until she canceled the coverage. Then they okayed it at the same time that they acknowledged that she had stopped their service. However, they kept her on their books for another 2 months, making it very difficult to get Medicare to pay for her pain medications because according to the system, she was covered by medical insurance, who are benefiting financially by her name on their books. Each and every person should be able to choose which doctor to go to, which hospital they want to go to, get alternative treatments that they know will help them, or at least to see if they work. Healthcare must be about what works for each individual and not about the profit for medical insurance or hospitals or pharmacies. Medical care, hospitals, and medicine should not be for profit.
Good afternoon. My name is Felwina Opiso Mondina, and I am with the Filipino Association of Workers and Immigrants, or PAWIS. PAWIS is a grassroots organization advocating for the rights and welfare of workers and immigrants in Santa Clara County. PAWIS had its beginnings in 2002, organizing Filipino airport screeners facing workplace discrimination after 9/11. Today, most of PAWIS members and contacts are caregivers and or domestic workers working in residential care facilities, nursing homes, assisted living facilities, home care agencies, and private homes. Caregivers endure poor working conditions and are victims of wage theft. The other speaker is saying that the cost of long-term health care is so expensive. But don't you know that these businesses just pay their caregivers minimum wage or below minimum wage? Woo! This classification of workers as independent contractors and retaliation are prevalent in the caregiving industry. Moreover, despite working for the healthcare industry and being more vulnerable to contracting COVID-19, particularly the highly infectious and fast-spreading Omicron variant nowadays, many caregivers lack the basic health insurance, or if they have one, it's inadequate. Last December, we have a member who felt that she was having stroke-like symptoms while riding the bus. However, she does not have a health insurance and was so afraid of checking into emergency for fear of incurring expenses. We finally persuaded her to see the doctor the following day. They ran tests and found nothing. However, when she saw her bill last week, She almost had a heart attack because it amounts to $6,000. Where will she get the money to pay for it? Another PAWIS member was in a car accident last December and suffered broken ribs, which will take almost 8 weeks to heal. Now she's still feeling the pain in her chest, cannot work, no money, and was shocked to find out that her ambulance ride to the hospital was almost $2,000. She told me if she only knew how much the ambulance will cost, she would have declined it. But at that time, she was in so much pain and was so disoriented. The income of the caregivers and or domestic workers is barely enough for their basic necessities in order to survive living in this very expensive county. Factoring in wage theft, basic expenses, and regular remittances to their families in the Philippines, they just have enough left for rent, for transportation, and no money to buy health insurance. Also, undocumented caregivers are not eligible to buy marketplace health coverage. While our county hospitals provide emergency care regardless of immigration status, but still, it is only during emergency. It is ironic that caregivers who provide care for the old and the most vulnerable in American society are the most vulnerable to sickness and death, especially now in the time of the pandemic. We want our caregivers to avail of a comprehensive health care so that they are confident that they are safe and healthy as they continue to provide care for our community. That's why on behalf of PAWIS, I wholeheartedly support AB 1400. Maraming salamat.
Over profit, the time is now. Healthcare
Over profit, the time is now.
Healthcare over profit.
The time is now.
Thank you everybody for being here today. I'm really honored to be with you all. My name is Yusra Hussain. I'm a physician, an internist, and the chair for the... Louder? Yeah. Can you guys hear me?
Yeah,
okay, is this better?
Yeah.
Okay, good. All right, so everybody in, nobody out.
Everybody in, nobody out.
Wonderful. So on behalf of the California South Bay Physicians for National Healthcare Program chapter, I'm honored to be here with you all today. And I want to give a shout to my colleague, Dr. David Leibowitz, who is also a wonderful physician and has been a great ally to the movement to push AB 1400 at the forefront of our our statewide legislation. We have had numerous meetings with local representatives urging them to support AB 1400. I'll tell you folks, the fight is uphill. It is really a big fight that we have to put up. We need every single one of you today to find at least 2 people to talk to urge them to call their representative to essentially support AB 1400. What you read in the news today is that the citizens of California are worried about increase in taxations because of AB 1400. That is not true. As you heard earlier, our wonderful member, Salem Ajluni, explained to you all that the citizens of California, even the wealthy one, will take home money, and there will be more left to take care of every single member of our lovely state to be covered, regardless of their immigration status, of their national origin, of their language, of their creed, or ethnicity or belief system. Everybody should be included in health right. No one as far as I'm concerned, if my daughter's nanny or if the gardener or if my nurse in the office is sick, we are all affected by that. It doesn't matter. Or if the janitor who cleans my office is sick, that affects the health of our nation.
That's right.
Everybody deserves to have access to health care. I have witnessed firsthand one of the caregivers who took care of my patients who did not have health coverage because she just fell short of getting medical. She couldn't afford to pay for her health care. I heard her talking about seeing blood in her urine, and sure enough, I ordered an x-ray for her, and she had a stage 4 bladder cancer. It was too late for her to get health care at that point. This could have been prevented, could have been easily prevented, not, required even a surgery at that point if she had showed up to her doctor's office and been diagnosed early on. The sad reality is, not only my patient lost her as a wonderful caregiver of 20 years, but her entire family of 3 children and 6 grandchildren. They will never spend a day with their grandmother again because of a treatable condition that could have been prevented. Today, we have more than 3.2 million Californians without health insurance. This is not going to change unless we get AB 1400. If we don't get our elected health officials to actually recognize that we are serious about this, because believe it or not, Governor Newsom is not serious about it. There is a push by Health California now to come up with an alternative bill. I'm sorry, but AB 1400 as a physician is the best bill that we have.
Healthcare over profit! The time is now! Healthcare over profit! The time is now!
Hi folks, my name is David Leibowitz. I'm a retired hematologist. I'm a member of Physicians for a National Health Program and of the Santa Clara County Single Payer Coalition. I want to talk to you about a couple of aspects of single payer health care. One thing to think about is that our country was the first major industrialized country to establish a public education system. Why did we do that? We did that because the founding fathers believed that the only way to have a functional democracy was to have educated citizens who could make wise decisions and who would be better workers because they were better informed. Unfortunately, we never carried that logic through to healthcare. Most of the other major industrialized countries, at about the same time they set up public education, also set up healthcare systems so that every person was covered. The logic there was that having a healthy population would again allow workers to be more productive. It would keep them from having to be off work for illness, and they would be more active as they worked. So we need AB 1400. Now, I'm a retired hematologist, so I've taken care of a lot of patients who have very frightening, debilitating, sometimes fatal diseases. During the last 10 to 15 years, one of the most exciting things we've seen has been the appearance of multiple new medications that can treat these diseases, certainly control them, and sometimes cure them. The problem is that those new medicines are incredibly expensive. And it's very sad when my patients come to see me and tell me they cannot afford the medicines that would have provided them relief from these frightening disorders. So where do we go from here? Well, as you've heard, California has a chance to lead the nation. AB 1400 will establish a fantastic medical system in California. I need to caution you about the big lie that has already started. You're going to hear that this bill will increase taxes on everyone in the state. Well, how does that work? The taxes are progressive. If you don't have much money, you don't pay much in tax. The other thing that no one will mention is that AB 1400 eliminates insurance premiums, eliminates deductibles, eliminates co-pays, and eliminates costs of medication. So the amount of money that everyone saves is vastly greater than the insurance premiums. So we will have a very hard fight. The insurance companies and the pharmaceutical companies are taking billions of dollars out of our healthcare system and not putting anything back in that improves our lives. Let's support AB 1400.
The time is now.
Healthcare over profit. The time is now. Healthcare over profit. The time is now.
Good morning. My name is R.J. Ramsey. I'm with a group called the Unhoused Response Group. Good morning. My name is R.J. Ramsey. I'm with a group called the Unhoused Response Group, and we go out and we provide assistance to unhoused citizens of the county and Santa Clara County and San Jose in particular. And we recognized the need back in March 2020 at the start of the epidemic, the pandemic, that the unhoused citizens in our community weren't receiving any information about the virus. It was hitting them at an alarming rate, and we decided we needed to start stepping in there. So myself, I'm formerly unhoused. I was on the street for 10 years, and I may not look like it, but I actually practiced corporate law for 20 years. As a result of a divorce, a job loss, and a mental health condition, I found myself on the street for 10 years. So it can happen to anybody. The face of the homeless is changing out there. You will see families out there now, children, your neighbors, your brothers, your sisters are all out there right now. So if you think I'm talking about people that don't affect you, you're wrong. And one of the things that we see out there is people are dying from simple diseases that are treatable, but there's no health care provided for them out on the streets. What you see reflected behind me are tombstones that were from a memorial service this past December. 250 people unhoused died in Santa Clara County last year. Half of them were seniors over the age of 62. That's just, I can't even imagine how awful that must feel to be alone and dying out on the streets. Many a times we call an ambulance for people. The ambulance shows up and says, oh, they don't have health coverage. Where they try to treat them on the spot and they leave. Or we've had some people left at the hospital outside the ambulance for hours, only to leave and walk away because nobody came out there to treat them. These kind of things have got to stop. As I said, we had 250 people who died this past year. 2 of them were twins, the age of 2 months old. So these kind of things have to stop. So we definitely support AB 1400. But we want you to remember, your unhoused residents in Santa Clara County need health coverage as well. Thank you.
The time is now. Healthcare over profit. The time is now.
And now we'd like to have Salem say a few words. Thank you so much, everybody, for coming out. The time is now, people. The time is now. So thanks for attending our rally. And now we're going to do the car caravan. Join us on our conference call line. It's 425-436-6384. Our access code is 194-1183. It's also written on this poster board. Okay. Yeah, while we're doing this, I need you to also call your assembly members. Okay, we need to talk to Evan Lowe and Mark Berman and demand that they support AB 1400. And we need to move this California state legislation. We need to ask that our California state legislators please move this bill forward now. Today, we are visibly demonstrating through in our communities throughout California, and this is only one of 15 actions across the state. There's a huge, huge rally in Sacramento at the state capitol right now. It's happening right now. Thank you so very much for being a part of this action, you guys. And now I'm going to turn it over to Salem, and he is going to talk to us. Thank you so much, all you groups, for coming out. It's an honor to be in this fight with you. And I'd also like to thank the California Nurses Association for Salem.
Yeah, I just want to encourage everybody to take out your phones and to dial the conference call number 425-436-6384. The access code is 194-1183.
Well, what's that?
Yeah. The phone number is 425-436-6384. The access code is 194-1183 hashtag. Has everybody got that? No. Okay. 425-436-6384. Access code is 194-1183 hashtag. One more time. 425-436-6384. Access code 194-1183 hashtag. That conference call will put you in connection with everybody that's going to be in the car caravan today. I'm just going to give you the basic route so you understand where we're going in our cars. Our cars are going to be, we're partly lined up already in the parking lot on King Road here. We're going to be exiting the parking lot and turning left onto King Road, and we're going to stay on the far right lane on King Road. We're going to pass under the 680 overpass, and when we get to Story Road, there's a Shell station, a Shell filling station there on the right side. We're going to turn right. We will pass over Highway 101. We'll pass McLaughlin Avenue, another traffic, there's actually two other traffic signals before McLaughlin. We'll pass McLaughlin on Avenue. We will pass Little Saigon on the right side of the road on Story. We'll merge to the right, stay in the far right, and we'll turn right at Lucretia Avenue. This is the entrance to Vietnam Town. It's also known as Vietnam Town Road. And we'll go to the stop sign there. You'll see a stop sign and a whole series of mailboxes, and turn right. The point is, follow as closely as we can. Stay as close as we can. We're probably going to get separated by traffic signals that stop us. But if you're on the conference call, you'll be able to hear where we are at every moment. So stay connected. Put the speaker on your speaker phone so that you can hear it while you're driving, and we'll stay together that way. When we leave Vietnam Town, we're going to return to Story Road. We're going to go back over Highway 101. We're going to turn left onto King Road again. We're going to come back on King Road. But way before we get here, we're going to be turning right on the road that's called Kammerer Avenue. And that's where we will end. We will end on Kammerer Avenue near, you'll see Zoletzi Park on your left side, and you'll turn right on Kammerer Avenue, right off of King Road. It's right on this road, but way ahead there on our way back. And we'll end up at the Mayfair Community Center and Mayfair Park, which is a dead end on Kammerer. So Kammerer dead ends basically into the park, the Mayfair Park and the Mayfair Community Center, and that's where the caravan will end. I want to thank all of you. I counted about 45 people. We weren't expecting half this number originally. Thank all of you for attending. Be sure to call your assembly representatives and encourage everyone to call them to support AB 1400. Healthcare over profit. The time is now. Thank you.
Our cell phones are all working. Everybody's all signed in. And take it away.
Okay, my name is Felwina. I'm working with the COVID-19 Action Network, and we are focusing mostly on a bomb that hit the Raza, Chicano, Mexicano, Latino community, which is this COVID-19 that has killed and that has affected the majority of our gente. For one thing, you are standing on Salem. This area is where the authorities had sent the Mexicans to live in these backward areas. Salem means get out if you can. This is the area, and they're still doing it to us. They're killing us with this COVID-19 by misinforming us, by not paying attention to what is going on with our raza. We are, as people call us, the essential workers, the workers that cannot stop from working because of the high cost of this capitalist system, that we can't even afford the rents. That is what's happening to us. And that's why we are being infected. We have to understand that we are standing in a system that has never, ever, ever been has preoccupied with human beings. They are right now privatizing everything, especially the broken down health system that is messed up, okay? It is broken down because it is privatized. There are only 2 testing sites here in Santa Clara County, and you have to make an appointment to get a COVID test on banking hours. You have to wait 15 minutes, and it's only available at certain times. What the hell is that? How are we going to stop our people from being hospitalized if they're not dealing with the COVID testing right now? Okay? That is a contradiction.